But it's all bullshit. Here's what he didn't mention in the proclamation. According to CDC staffers, the Trump administration has quietly withheld $140 million in federal grants specifically designed to fight fentanyl overdoses. That's money Congress already approved, money that was supposed to go to 49 states, DC, and dozens of local health departments for overdose prevention programs. One CDC staffer put it bluntly, these lives are at stake. The announcement alone could trigger layoffs and program shutdowns. It could really start a chain reaction that's hard to come back from. These programs, part of what's called the Overdose Data to Action Initiative, fund the people who distribute naloxone, commonly known as Narcan, the drug that reverses overdoses. They fund the surveillance systems that track new toxic substances hitting the streets. They fund treatment programs and prevention efforts in communities across America. And here's the kicker. They were working. Overdose deaths had finally started dropping dramatically, from a peak of over 114,000 deaths in August 2023 down to about 82,000 this year. Public health experts say expanded federal funding under the previous administration was a key reason for that progress. But now many of these programs are set to run out of money by September 1st. States like Vermont have already paused spending because they can't get clarity on whether the funding will come through. And it gets worse. The Trump administration has also laid off federal addiction researchers, dissolved key agencies that track drug use, and made cuts to Medicaid, which funds most of the addiction treatment in America. One study estimates that could lead to 156,000 people losing access to treatments like methadone and Suboxone, potentially causing 1,000 additional deaths per year. So we have a president proclaiming a week dedicated to overdose prevention while his administration systematically dismantles the infrastructure designed to prevent overdoses. One addiction researcher at Boston University put it this way: it feels like we're throwing in the towel exactly when we were beginning to make progress. If we really want to save lives, we need stable funding for treatment, harm reduction, and community support. The families who've lost loved ones to overdoses deserve better than empty proclamations. They deserve action that matches the rhetoric. And right now, that's not what they're getting. As always, I'm Eliza Orlins, career public defender for 15 years in Manhattan. And if you made it this far, thank you for being here.